The evidence in metastatic colorectal cancer continues to come from large clinical trials. And the most striking example in the last few years, I would say, has been the 80405, which is a large study looking at what's the best first-line biologic to use, and taught us that right-sided versus left-sided tumors should be treated differently from each other. And that has been practice changing to change the guidelines, and has been an important addition to the knowledge in terms of what's the best therapy to use. I'd say the second most important thing has been immunotherapy, and the lesson that microsatellite high patients benefit from immunotherapy. More recent data showing that combination immunotherapy is especially effective in this patient population. So combining CTLA-4 plus PD-1 seems to be effective, and there's ongoing trials now looking at PD-1 or PD-L1 inhibitors in the adjuvant setting and also in the first-line setting, because those are approved for second-line and above. And so we'll see how those trials pan out. So for ASCO 2018, I would say the bottom line is that there have been multiple incremental benefits, looking at a few different themes. One theme is biomarkers, and we continue to have additional subsets of colorectal cancer, just as with other diseases. We knew about BRAF, we've known about NRAS and KRAS. We're starting to learn now about HER2, and we're starting to get more information about MSI high. And I think as time goes on, we'll see more and more of these biomarkers. And of course, an emerging question is, can we just use circulating tumor DNA, or do we really need to biopsy patients again and again to figure out what's going on in their body? A second theme is immunotherapy, and whether combination immunotherapy will be useful for these patients. And another one is sequencing of therapy. In other words, does starting with drug A, going to drug B, or B then A, does it make a difference? And what's the best maintenance approach? And these are the kind of questions that have been addressed in ASCO 2018.